If you're over 50 or care for someone who is, the next few minutes could be life-changing. Today, you'll discover 12 unusual signs that your liver may already be under silent attack. These aren't the typical signs most people expect. Imagine this. Inside your body, there's an organ working tirelessly, day and night, without breaks, without complaints. It filters toxins from your blood, stores energy, produces essential proteins, regulates your metabolism, and supports your immune system. It performs over 500 distinct functions just to keep you alive. And yet, this organ doesn't make a sound when it's in trouble. That organ is your liver, a quiet protector, but also a silent sufferer. Unlike your heart, which races, or your stomach, which cramps when something's wrong, your liver doesn't hurt. It has no pain receptors. So even if it's being damaged day by day, it rarely lets you know. That's what makes liver disease so dangerous. It hides behind normal routines, vague symptoms, and assumptions like, I'm just getting older, or it's probably just stress. But here's the truth. Liver damage doesn't start with dramatic symptoms. It starts quietly, with signals so strange, so unexpected, that even doctors may miss them. Like itchy feet at night, or fingernails that suddenly change color. A weird taste in your mouth. Unusual tiredness you can't explain. A belly that grows even when you're not gaining weight. These are not just random signs. A study from the German Liver Foundation found that over 5 million people in Germany alone suffer from liver disease, but more than 70% have no idea. That's millions walking around, going to work, taking care of family, while their liver slowly fails without warning. But there's good news, and it's powerful. The liver is the only organ in your body that can regenerate itself completely. Even if up to 75% of it is damaged, it can heal. But only if we catch the signs early, before the damage becomes irreversible. That's what this video is about. We'll explain why each symptom happens, what it means, and what action to take. And don't worry, we won't just scare you. We'll give you real hope, science-backed guidance, and clear next steps. Before we dive in, we'd love to hear from you. Which city are you watching from? Drop it in the comments below. It helps us understand our community better, and it lets us connect with you more personally. Also, if you've noticed any strange symptoms lately, maybe ones your doctor couldn't explain, tell us about it. You never know who else might benefit from your experience. Let's begin with the very first and perhaps most surprising symptom. Section 1. Itchy feet at night, a sign hidden beneath the skin. It starts innocently enough, just a bit of itching on the bottom of your feet before bed. But the itching doesn't stop. In fact, it gets worse. It moves to your ankles, then your legs, sometimes your back. Soon you're waking up in the middle of the night, scratching until your skin is red, irritated, even bleeding. This kind of itch, the kind that doesn't go away, doesn't respond to creams, and gets worse at night, could be much more than a skin issue. It could be your liver sending you a desperate signal. This condition is known medically as pruritus, and in people over 50, especially those with early liver dysfunction, it's one of the first signs that something deeper is wrong. But why would your skin itch when your liver is damaged? The answer lies in bile salts, a substance your liver produces to help digest fat. In a healthy body, bile is made in the liver, stored in the gallbladder, and flows into the intestines. But when the liver is damaged or the bile ducts are blocked, those bile salts don't leave the body properly. Instead, they build up in the blood and eventually get deposited under the skin, where they irritate nerve endings, especially in areas with thick skin like the palms and soles. And the timing isn't random either. At night, your body produces less cortisol, a hormone that normally dampens inflammatory signals. That means the itching intensifies while you're trying to rest, often leading to sleep disruption and even emotional distress. People describe it as a crawling feeling, unbearable, and worse than pain. In some cases, it can become so severe that it leads to anxiety, insomnia, or depression. A study by the University of Munster examined over 800 patients with chronic liver disease. The results were striking. 84% of them reported unexplained, chronic itching, often months or even years before being diagnosed with liver problems. Even more concerning, 90% of those patients first saw a dermatologist, not a liver specialist. Most were told it was dry skin, aging, or stress. Dr. Sarah Fisher, a dermatologist at the University Hospital in Berlin, says, "When a patient comes in with persistent itching and no visible rash, especially on the hands or feet, I always consider liver function. It's one of the most overlooked early signs. There are certain patterns to this liver-related itch that make it distinct. It usually starts on the soles of the feet or the palms of the hands. It worsens at night, especially after hot showers or in warm environments. It doesn't respond to typical treatments like moisturizers or antihistamines. Scratching doesn't bring relief, only more frustration. It may come and go, making it even more confusing to diagnose. So what should you do if you're experiencing this kind of itching? Don't ignore it. If the itch is persistent, especially if it's worse at night and doesn't respond to skin treatments, talk to your doctor. Request liver function tests like ALT, AST, ELP, and bilirubin. These are simple blood tests that can reveal if your liver is under stress. Watch for other signs like fatigue, nail changes, or yellowing of the eyes that may confirm the pattern. Avoid hot baths, alcohol, and high-fat meals, all of which can worsen bowel buildup and itching. Support your liver with anti-inflammatory foods, hydration, and by avoiding unnecessary medications that are hard on the liver. The itch may seem like a minor nuisance, but if it's coming from your liver, it's not minor. It's a whisper from your body asking for help. Section 2. Red palms. When your hands are speaking for your liver. Have you ever looked at your hands, really looked, and noticed something unusual? Most people don't notice it. Others assume it's poor circulation, or maybe just aging. But for those over 50, red palms, also called palmar erythema, can be a subtle but significant sign of something much deeper. A liver struggling to manage your hormones. Let's break it down. Your liver is responsible for metabolizing estrogen, not just in women, but in men too. When liver function declines, due to fatty liver, chronic hepatitis, or early-stage cirrhosis, it can no longer clear excess estrogen efficiently. The result? Estrogen begins to build up in the bloodstream. This excess estrogen causes the tiny capillaries in your hands, especially in the palms and base of the fingers, to dilate. And that dilation leads to a persistent red or pink flush, often most visible in the thenar, thumb, and hypothenar, pinky regions, base of the fingers, sometimes extending to the fingertips. According to a large study published in Clinical Gastroenterology, palmar erythema was observed in more than 60% of patients with liver cirrhosis, even in early stages, and sometimes long before other symptoms appeared. Dr. Ellen McCarthy, a hepatology researcher from the Cleveland Clinic, explains, red palms may look harmless or even healthy, but in the context of liver dysfunction, they are among the earliest and most consistent dermatologic signs we see. Now, here's the challenge. Palmar erythema can occur during pregnancy or as part of normal aging in postmenopausal women. So how do you know when it's a concern? Pay attention to these clues. The redness is symmetrical, affecting both hands. It does not blanch completely when pressed. Test it with your thumb. It appears alongside other subtle liver signs, fatigue, itching, spider veins, or nail changes. There's a history of liver risk factors, alcohol use, high-fat diet, chronic viral infections. Still not sure? Try this simple home test. Press firmly with your thumb on the red part of your palm for 2 to 3 seconds. Release. If the redness blanches partially but returns quickly and unevenly, it's likely vascular dilation. Healthy palms usually don't show this pattern. It's also important to track the progression over weeks. Is the redness spreading toward the fingers? Does it intensify after meals or heat exposure? Are your hands feeling warmer than usual, even in cool environments? In women, this sign can mimic hot flashes, leading to it being dismissed as hormonal or age-related. But when tied to liver dysfunction, it tends to persist and slowly intensify. What should you do if you notice it? Get liver blood work. Check hormone levels, including estradiol and testosterone, yes, even in older men. Request a hepatic ultrasound, especially if combined with other symptoms. Limit estrogenic foods and alcohol, which can worsen hormonal congestion. Support detox pathways with cruciferous vegetables and mild liver herbs, under professional guidance. Section 3. Nail discoloration and brittleness, the small windows into your liver. Most of us don't pay much attention to our fingernails until they chip, crack, or look a little off. But here's the truth. Your nails are one of the earliest and most visible mirrors of your internal health, especially your liver. Why? Because your liver is responsible for producing many of the proteins, nutrients, and building blocks your body needs to grow healthy tissue, including the keratin proteins that form your nails. When the liver becomes damaged or starts to fail, it stops producing these proteins in the right amounts. That subtle internal shift often shows up first in your nails, long before any blood test detects a problem. One of the most distinctive signs of liver dysfunction in nails is known as Terry's nails. First described by Dr. Richard Terry, this condition is marked by fingernails that appear mostly white or milky, with only a thin pink or brown band at the very tip. It's not a polish or stain. This is a structural change in the nail bed caused by reduced blood flow and protein synthesis, both of which are disrupted in liver disease. Another telltale sign? Muir's lines, white, horizontal bands that stretch across the nail. These lines don't move as the nail grows because they're not in the nail itself, but in the underlying nail bed. They're closely linked to low serum albumin, a protein made by the liver. When albumin levels drop, these lines begin to appear, often without any other noticeable symptom. A study from the Mayo Clinic analyzed 400 patients with cirrhosis and found that 67% showed visible changes in their nails, often years before their liver disease was diagnosed. Dr. Andreas Schultz, a hepatologist at Charite Hospital in Berlin, puts it simply: nails don't lie. Sometimes they speak before the liver numbers do. So, what nail changes should you watch for? Let's go through the most common liver-related changes. Terry's nails. Milky white appearance covering most of the nail. Only a narrow pink or brown band at the tip. Often symmetrical and found on multiple fingers. Muir's lines. White horizontal lines that don't move with nail growth. Indicate low protein levels in the blood. Clubbing, drumstick fingers. The tips of the fingers become bulbous. The nails curve downward and appear spooned or rounded. Caused by reduced oxygen and protein production. Yellow or pale nails. Not related to nail polish or aging. Can signal sluggish liver detoxification and bile flow problems. Brittle or splitting nails. Cracking, breaking, or peeling easily. Indicates poor nutrient absorption, common in liver dysfunction. Slowed nail growth. Nails that used to grow quickly now take longer. A subtle, yet powerful early signal of declining protein synthesis. What makes nail changes especially powerful as a diagnostic clue is their early onset. Your nails grow slowly, about 3 millimeters per month, so they preserve signs of dysfunction in a visible, traceable way. Long before your skin yellows or your belly swells, your nails may already be waving a red flag. If you notice any of these changes, especially if they appear suddenly or persist without improvement, here's what you should do. Get your liver checked. Ask your doctor to run liver function tests, ALT, AST, bilirubin, albumin, and clotting factors. Increase protein quality. Focus on liver-friendly proteins like eggs, legumes, and wild-caught fish to support keratin production. Don't ignore symmetry. When multiple nails show the same change, it's more likely a systemic issue, not local trauma. Avoid self-diagnosis. Not all nail changes are dangerous, but if you're over 50 and notice new, persistent changes, they deserve attention. Nails may seem like a small detail, but they can tell big truths. In many cases, they're your body's first and only early warning system. Section 4. A metallic taste in the morning, when your breath speaks for your liver. You wake up in the morning, head to the bathroom, and notice it again, that strange, bitter taste lingering on your tongue. You brush your teeth. You rinse your mouth. You drink a glass of water. But the taste doesn't go away. It's metallic, slightly sour, almost like copper or iron. Maybe you assume it's from last night's dinner, or perhaps just morning breath. But what if this odd taste is more than just a nuisance? What if it's your liver trying to get your attention? This symptom is known in medical literature as hepatic failure, sometimes called feta hepaticus. It refers to the distinct smell and taste that can occur when the liver begins to fail at processing certain toxic substances, especially ammonia and volatile sulfur compounds. And while feta is usually associated with advanced liver disease, a metallic taste in the mouth can appear much earlier, acting as one of the first subtle clues that your liver is no longer detoxifying properly. But how does it happen? Your liver is your body's filter. It takes harmful compounds like ammonia, nitrogen waste, and certain metabolic byproducts, and converts them into safe substances that can be excreted. When the liver is damaged or overwhelmed, these toxins start to accumulate in the blood, and eventually, they make their way to the lungs and saliva, altering both the smell of your breath and the flavor in your mouth. In fact, research published in the Journal of Hepatology found that over 50% of patients with early liver disease reported either a bitter or metallic taste in the morning, often months before more dramatic symptoms like jaundice or swelling appeared. Dr. Emily Harrison, a liver specialist from New York, explains, "People often come in saying, 'Something just tastes wrong when I wake up.' When we investigate further, it's often their liver function that's beginning to falter." So how can you tell if the taste in your mouth is liver-related? Here are a few patterns to watch for. The taste is metallic or bitter, not sour like acid reflux. It persists after brushing teeth or using mouthwash. It's most noticeable in the morning, but may linger throughout the day. It's accompanied by dry mouth or a slightly sweet or sulfuric breath odor. It gets worse after high-protein meals, alcohol, or medications. These clues are important because they help distinguish between common issues like poor oral hygiene or GERD and systemic problems like liver dysfunction. There's also a simple home test that many doctors recommend. Gently scrape your tongue in the morning with a clean spoon or tongue scraper and smell it. If the odor is sharp, ammonia-like, or sweet-sour, it could be related to liver toxin buildup. Of course, this isn't a diagnosis, it's just a clue. But when combined with other early signs, like unexplained fatigue, itchy skin, or nail changes, it paints a much clearer picture. So what should you do? Don't ignore it. If you consistently wake up with a metallic or bitter taste, and brushing doesn't help, it's time to investigate. Ask for liver function tests. Watch your diet. Reduce high protein, processed foods, and alcohol. These increase the load on your liver and raise ammonia production. Stay hydrated. Drinking plenty of water helps flush out toxins and reduce dry mouth, which can worsen the taste. Support your liver with sulfur-rich vegetables like broccoli, garlic, and onions. They help your body produce glutathione, the liver's master antioxidant. Your mouth is part of your detox system, and often it's the first place where liver overload becomes obvious. So if your toothpaste isn't fixing it, your liver might need attention. Section 5. Exhaustion you can't shake off, when fatigue isn't just about sleep. Everyone gets tired. A long day, a bad night's sleep, a heavy meal. But this is different. This is the kind of exhaustion that doesn't go away, not after a nap, not after a full night's rest, not even after a week of taking it easy. It clings to you like a fog. Your body feels heavy. Your mind feels slow. Even simple tasks feel overwhelming. And here's the alarming part. This kind of unshakable fatigue may not be caused by aging or poor sleep hygiene. It may be caused by your liver. Doctors call it hepatic fatigue, and unlike normal tiredness, it's not solved by more rest. It stems from the fundamental metabolic disruption that occurs when the liver can no longer manage its two key jobs: storing and releasing energy, detoxifying the bloodstream. Let's break this down. Your liver is your energy reservoir. It stores glycogen, a form of glucose your body uses for quick fuel. When your liver is stressed or damaged, its ability to convert glycogen into usable energy is impaired. That means even if you've eaten, your body may feel like it's running on empty, like trying to drive a car with a full tank but a broken fuel line. At the same time, a sluggish liver fails to filter out toxins efficiently. These waste products, especially ammonia, bilirubin, and inflammatory cytokines, can accumulate in the bloodstream and start affecting the brain. That's where the mental fog, poor concentration, and memory slips come in. It's not just physical fatigue. It's cognitive fatigue, a full-body slowdown. A 2021 study in the Annals of Hepatology found that 72% of patients with early-stage liver dysfunction reported chronic exhaustion, despite having normal sleep patterns. Most of them were misdiagnosed with depression, anemia, or thyroid issues, until liver testing revealed the true cause. Dr. Linda Mahoney, a hepatology specialist at Johns Hopkins, explains, "When a patient says, 'I feel like I've been hit by a truck every morning,' I check their liver. Especially if the fatigue comes with brain fog, irritability, or appetite loss." So what makes hepatic fatigue different from regular tiredness? Here are a few key signs. You feel worse in the morning, even after 7 to 9 hours of sleep. You crash after meals, especially fatty or heavy ones. You struggle with focus, memory, or decision-making. Your muscles feel weak, even without exercise. You feel emotionally flat, unmotivated, or withdrawn. Coffee doesn't help, and sometimes makes you feel jittery or nauseous. It's not laziness. It's not getting older. It's your liver falling behind on its responsibilities. And because the liver has no pain receptors, fatigue may be the only symptom your body gives you. What can you do if you suspect your exhaustion is liver-related? Request a comprehensive liver panel. Track your energy patterns. Keep a journal of how your energy fluctuates. If it consistently dips in the morning or after eating, that's a red flag. Reduce your liver's workload. Limit alcohol, processed sugars, and fried foods. Opt for whole foods that are easier to metabolize. Hydrate and move. Mild movement, like walking or stretching, and plenty of water help stimulate circulation and detox pathways. Support your mitochondria. Nutrients like B vitamins, magnesium, and CoQ10 help the cells in your body and brain use energy more efficiently, even when your liver is underperforming. So if you feel like you're living in slow motion, if your brain feels like it's stuck in molasses, and if even joy feels out of reach, don't just sleep it off. Section 6. Yellowing of the eyes, the first visible sign of a failing liver. You look in the mirror one morning and something feels off. Your eyes look a little different. Not red, not irritated, just tinted. A faint yellowish hue, like someone turned the brightness down. Let me be very clear. If the whites of your eyes, the sclera, are starting to look yellow, that is not a trick of the light. That is a message from your liver. This condition is called scleral icterus, and it's often the first visible sign of liver dysfunction, long before your skin shows any changes. Why do the eyes change first? Because the sclera is made of collagen-rich, translucent tissue with very little pigment. That makes it extremely sensitive to bilirubin, a yellowish waste product that your liver is supposed to break down and remove. When the liver can't do its job, due to inflammation, blockage, or damage, bilirubin builds up in the blood, and the eyes are the first place where it becomes visible. Many people associate jaundice with yellow skin. But skin takes longer to discolor because it contains melanin and thicker layers. The eyes, on the other hand, offer a clear early warning. According to a study from the American Journal of Gastroenterology, over 80% of patients with chronic liver conditions developed yellowing of the eyes before any other noticeable symptom. In fact, many reported seeing the yellow hue weeks or months before seeking medical help. Dr. Sarah Ling, a hepatologist at UCLA, explains, "When someone walks into my office and says, 'I think my eyes look a little yellow,' I don't wait. That's a liver test appointment today." So how can you tell if your eyes are showing true signs of bilirubin buildup? Here are a few things to watch for. Color appears in both eyes, not just one. It doesn't change with lighting or go away when you blink. It looks like a subtle lemon or tea stain, not bloodshot or veining. It's most visible in natural daylight, especially morning light. It may be accompanied by fatigue, loss of appetite, or dark urine. Some people mistake this for dry eyes, allergies, or just getting older. But yellowing of the sclera is not normal, at any age. It's also not always caused by severe liver failure. Sometimes it's the result of bile duct blockages, fatty liver, or even medication-induced stress on the liver. Whatever the cause, it requires urgent investigation. Here's what to do if you notice yellowing of the eyes. Get a bilirubin test. A simple blood panel measuring total and direct bilirubin levels can confirm if your liver is clearing waste properly. Don't wait for skin discoloration. If you see it in your eyes, it's already in your bloodstream. Check your medications. Certain drugs like acetaminophen, statins, and antibiotics can stress the liver. Bring a full list to your doctor. Monitor other signs. Dark urine, light-colored stools, right upper abdominal pain, or nausea can help confirm a liver-related issue. Stay calm, but act quickly. Yellowing doesn't always mean something fatal, but delaying care increases risk. Your body is talking, and your eyes are its most honest voice. So if you notice a yellow tint, even the slightest one, don't wait. Section 7. Spider veins on the face or chest, when tiny red stars speak volumes. Spider veins are clusters of dilated blood vessels that radiate outward from a central point, like the legs of a spider. They can be caused by a number of things, from sun exposure to hormonal changes. But when they begin to appear in clusters, especially on the face, neck, chest, or upper arms, they may signal liver dysfunction. Why? Because when your liver becomes compromised due to fatty liver, cirrhosis, or chronic inflammation, it loses its ability to metabolize hormones, especially estrogen. In both men and women, elevated estrogen levels cause tiny blood vessels near the skin to dilate and expand, leading to visible spider veins. According to a large-scale study in Hepatology International, over 65% of patients with liver cirrhosis had noticeable spider angiomas in the upper torso region, often before more severe symptoms developed. Dr. James Holloway, a hepatologist from Mayo Clinic, explains, "Spider angiomas can look harmless, like a small cosmetic issue. But in the context of liver disease, They're one of the earliest and most visible indicators that hormone metabolism is failing. So how do you know if the spider veins you're seeing are truly liver-related? Try this simple test. Press the center of the red spot with your fingertip or the back of a pen. If it fades completely and then reappears after a second or two, it's likely a spider angioma. The central hub is usually a small red dot with thin lines radiating outward. It's most often found on cheeks, chest, neck, or upper arms. And it's often not itchy, painful, or raised. These signs are different from normal varicose veins or sun-damaged capillaries. They reflect vascular dilation due to internal chemical imbalances, specifically excess estrogen and nitric oxide buildup, both poorly processed by a sluggish liver. Here's when spider veins should prompt real concern. If they appear suddenly and in greater numbers. If they're accompanied by other signs like fatigue, yellowing eyes, or itching. If you're male and noticing other estrogen-like symptoms like gynecomastia or decreased libido. If you have a history of alcohol use, fatty liver, or hepatitis, what should you do? Don't rely on skin creams. Topical treatments won't solve the internal cause. Request a liver hormone panel. In addition to liver enzymes, ask for estradiol and prolactin levels. Reduce liver stress. Avoid alcohol, processed fats, and high fructose foods, all of which worsen hormonal congestion. Increase intake of cruciferous vegetables like broccoli and cauliflower. These contain compounds like indole, 3-carbinol that help process excess estrogen through the liver. Consider milk thistle and dandelion root under medical guidance. Both support hepatic detox pathways. Section 8. Dark urine and pale stool, a gut signal from the liver. If you've recently noticed that your urine is darker than usual, not amber or golden but brownish, tea-colored, or even cola-like, that's not dehydration. And if at the same time, your stool looks pale, grayish, or clay-colored, that's not a coincidence. It's a textbook warning from your liver. These two changes, when they appear together, are often signs of bilirubin imbalance. Here's how it works. Your liver breaks down old red blood cells and converts them into bilirubin, a yellowish substance. Normally, this bilirubin travels through the bile ducts into the intestines, giving stool its normal brown color. A small amount is also filtered through the kidneys and expelled in urine, giving it a light yellow hue. But when the liver is inflamed, damaged, or blocked, bilirubin doesn't flow properly. Instead, it accumulates in the bloodstream, gets dumped into the urine, and bypasses the stool. The result? Dark urine, from excess conjugated bilirubin, pale or clay-colored stool, from a lack of bile pigments, and often yellowing of the eyes or skin not far behind. According to a clinical review in The Lancet, these two symptoms together are among the earliest indicators of cholestasis, a condition where bile flow is obstructed, often due to gallstones, hepatitis, fatty liver, or even liver tumors. Dr. Karen Blackwell, a liver specialist at Duke University, notes, most people notice the dark urine first, especially in morning light, but they ignore it until the pale stool shows up, and by then, the liver is already in distress. So how can you tell if your symptoms are serious? Watch for these combinations. Urine that's consistently brown or dark orange, even with proper hydration. Stool that loses its normal brown tone, appearing yellowish, gray, or beige. Itching, especially on the palms or soles. Nausea, bloating, or right upper abdominal pressure. Fatigue or appetite loss in the background. But wait, can medications cause similar effects? Yes, some drugs can mimic these symptoms, including rifampin, can darken urine without liver damage. Phenazopyridine, for UTIs, causes orange urine. Iron supplements may cause darker stool. Bismuth-containing medications, like Pepto-Bismol, which can darken stool. Here's the key. If both urine and stool change together, especially without recent medication changes, your liver should be evaluated immediately. What should you do? Collect a sample or take a photo of the changes and bring it to your doctor. Visual records can accelerate diagnosis. Request a full liver panel, including bilirubin, total and direct, ALT, AST, alkaline phosphatase, and GGT. Ask for an abdominal ultrasound to check for bile duct obstruction. Hydrate properly, but don't assume dark urine means dehydration. Avoid fatty or greasy meals, which can further congest bile flow. So yes, it may be awkward. It may be uncomfortable. But your bathroom habits are vital signs. Section 9. Frequent bruising or bleeding, a silent risk from within. You wake up one morning and notice a bruise on your arm. You don't remember bumping into anything. A few days later, there's another one, on your thigh, your hand, your hip. Soft, dark patches that seem to appear out of nowhere. Then maybe it happens while brushing your teeth, your gums start bleeding, even though you're not pressing hard. Or you blow your nose gently, and there's blood. It's subtle. It's easy to dismiss. But behind these signs, something far more serious may be unfolding. Your liver is losing its ability to help your blood clot. Most people don't realize that the liver isn't just a detox organ. It's also your body's clotting factory. It produces nearly every essential coagulation factor, proteins that work together to stop bleeding after a cut, scrape, or internal injury. So when the liver becomes inflamed, damaged, or fibrotic, its ability to produce these proteins declines. The result? Frequent bruising, slow or spontaneous bleeding, prolonged bleeding from small cuts, unexplained gum or nose bleeding. According to a study in the Journal of Hepatology, bruising and bleeding abnormalities were among the top 5 early clinical signs in patients with undiagnosed liver disease, often preceding more obvious symptoms like fatigue or jaundice. Dr. Michael Lee, a hematology liver specialist from Johns Hopkins, explains, "Your skin and blood are mirrors of your liver's synthetic function. When bruises appear without trauma, or bleeding takes longer to stop, it's often a red flag that clotting factors are missing." What makes this especially tricky is that the symptoms may seem minor. Small bruises that grow slowly over days. Tiny red or purple dots, petechiae, on the legs or arms. Bleeding gums despite normal brushing. Blood after flossing or dental cleaning. Nosebleeds that occur without dryness or irritation. And here's where things get more serious. In women, low clotting factor production can make menstrual bleeding heavier, longer, or more painful. It can also increase risk during dental procedures, surgeries, or even mild trauma. So when should these signs prompt real action? If bruises appear regularly without any injury. If bleeding gums or nosebleeds become common. If you're taking blood thinners like aspirin, warfarin, or even fish oil alongside these signs. If you experience prolonged bleeding after cuts, dental cleanings, or minor surgeries. What tests can confirm the issue? Liver function panel, especially ALT, AST, and INR. Prothrombin time, PT, and partial thromboplastin time, PTT, to assess how long your blood takes to clot. Platelet count, to rule out bone marrow involvement. Vitamin K levels, which affect clotting and depend on liver processing. Here's what you can do in the meantime. Avoid medications or supplements that thin the blood, unless prescribed. That includes NSAIDs, ginkgo biloba, high-dose vitamin E, and garlic in large amounts. Increase intake of leafy greens, which contain vitamin K, crucial for clotting factor production. Stay hydrated and avoid alcohol, which worsens liver inflammation. Track your bruises and bleeding episodes. Photos and dates can help your doctor assess progression. Section 10. A swollen belly without weight gain. When bloating isn't just bloating. Have you noticed your belly changing shape, slowly, subtly, and without a change in your diet? Your liver normally produces albumin, a protein that helps keep fluid in your blood vessels. When the liver becomes damaged or scarred, through years of fatty liver, alcohol use, viral hepatitis, or other insults, it loses its ability to make enough albumin. At the same time, pressure builds in the portal vein, which carries blood from the intestines to the liver. This increased pressure, combined with low albumin, causes fluid to leak out into the abdominal cavity. That fluid has a name, acidic fluid, and its presence changes everything. The result? A belly that swells gradually without fat gain, a round, tight abdomen, especially in the lower half, feeling full quickly during meals. Shortness of breath as the fluid pushes up on the diaphragm. Clothes fitting tighter around the waist, while arms and legs remain thin. According to the American Journal of Medicine, ascites is often mistaken for weight gain or gas, especially in older adults. Yet in many cases, it's the first external clue of advancing liver dysfunction. Dr. Helen Rhodes, hepatologist at UCLA, explains, patients come in saying they've gained weight, but it's not fat, it's liters of fluid in their abdomen. And when we test their liver, the real problem becomes clear. What are the early signs you can watch for? Your belly expands, but your weight remains unchanged or even decreases. You feel uncomfortably full after small meals. You notice a sloshing feeling when you move or lie down. There's no significant gas or digestive cause, yet the bloating persists daily. The swelling gets worse as the day goes on, not better. Another major red flag is disproportion. If your arms and legs appear thin or even shrinking, while the belly continues to grow, this may be a sign of sarcopenia combined with fluid retention, a dangerous combination often seen in advanced liver disease. What can you do? First, request a physical exam that includes percussion of the abdomen. A trained physician can detect fluid by sound. Ask for a liver ultrasound, which can visualize fluid in the abdomen. Get a full liver panel including albumin, bilirubin, INR, AST/ALT. If fluid is confirmed, your doctor may perform a paracentesis, drawing some fluid out to analyze it. In the meantime, limit sodium intake. Salt worsens fluid retention. Avoid alcohol completely, even small amounts. Monitor your waist size weekly, not just your weight. Keep a bloating journal. Track when it worsens and whether positions or meals affect it. Sit upright after eating to reduce pressure on your diaphragm. Section 11. Brain fog and personality changes. When the liver affects the mind, it's more connected to your brain and mood than most people realize. There's a condition that doctors don't talk about often with patients, but it's quietly responsible for countless misdiagnoses in older adults. It's called hepatic encephalopathy. This occurs when a damaged liver can no longer filter toxins, especially ammonia, out of your bloodstream. Those toxins travel to your brain, where they disrupt normal function, leading to a wide range of cognitive and personality changes. And the early signs? They're often mistaken for just getting older. Let's look at them. You feel mentally cloudy, even after a good night's sleep. You repeat yourself in conversation without realizing it. You have trouble with handwriting. Letters look different, less controlled. Everyday tasks, paying bills, using your phone, cooking, become confusing. Your mood changes. You become irritable, withdrawn, anxious, or even euphoric for no reason. You feel disconnected from reality, like you're in a dream. In more advanced stages, family and friends may notice slurred speech or unusual pauses, trembling hands or flapping movements called hysterexis, sudden confusion, especially in the evening, changes in sleep patterns, such as staying up all night and sleeping during the day. These signs are often brushed off as depression, dementia, or just aging, but they could be reversible if caught in time. In fact, researchers from the Journal of Hepatology found that over 40% of people with cirrhosis develop mild to moderate encephalopathy, and many of them go undiagnosed for years. Dr. Samuel Layton, a neuroliver specialist at Johns Hopkins, explains, hepatic encephalopathy is often missed because it mimics age-related decline. But unlike Alzheimer's, this form of brain fog can be treated if the liver is supported. So how can you tell if it's your liver? Try this simple self-check. Write a short sentence, your name and today's date, in cursive. Now compare it to the same sentence written a week ago. If the letters have become shaky, uneven, or unusually spaced, this could be an early clue. Also ask yourself, have your close ones said you're not quite yourself lately? Have you become more forgetful, impulsive, or withdrawn? Have you started avoiding tasks that used to feel easy? If the answer is yes, and you have any other signs of liver dysfunction, like fatigue, itchy skin, swelling, or yellowing eyes, then it's time to take action. Request liver function tests, especially ammonia levels, bilirubin, and INR. Ask for a mini-mental state examination, MMSE, or neurocognitive assessment. Discuss hepatic encephalopathy with your provider, even if they haven't mentioned it. Review any medications that may worsen mental symptoms, such as sedatives. What can help? A low-protein diet may help in advanced cases, but only under medical guidance. Lactulose, a prescription laxative, helps remove ammonia from the body. Rifaximin, an antibiotic, can reduce toxin-producing gut bacteria. Stay hydrated and regular. Constipation worsens toxin buildup. And if this video gave you even one helpful insight, hit that subscribe button. We create every episode to serve people over 50, offering real science, calm guidance, and a voice you can trust.